Now, from CBS News Miami, this is Facing South Florida with Jim DeFede.
Welcome to Facing South Florida. I'm Jim DeFede. By now you have heard that Governor Ron DeSantis and Florida's Surgeon General, Dr. Joseph Ladapo, are moving to do away with all childhood vaccine mandates.
The Florida Department of Health, in partnership with the governor, is going to be working to end all vaccine mandates in Florida law. Every last one of them is wrong and drips with disdain and slavery. Okay? Who am I as a government or anyone else, or who am I as a man standing here now to tell you what you should put in your body?
Who are you? Well, theoretically, you're supposed to be the state's top doctor who should be providing honest and accurate information to the 23 million people who live here. So this morning, we will show what DeSantis and Ladapo can and cannot do. For his part, Ladapo has long been an anti-vaxxer. During that same press conference, Ladapo described the COVID vaccine as poison.
I mean, how many people put that poison in their bodies with these mRNA COVID-19 vaccines and wish they could turn back the hands of time?
The vaccine that saved millions of lives, he calls poison. But instead of keeping his misinformation directed to the COVID vaccine, he's targeting all vaccines, including the polio vaccine for school-aged children. Do we really need to make polio great again? I found this picture on the Mayo Clinic website about a class near the Minnesota Medical Center in the 40s that catered to children being treated for the disease. Is this our future? During his confirmation hearing, Ladapo's anti-vax views were well known, and State Senator Tina Polsky asked him if he would try to do the very thing he is doing today and do away with vaccine mandates.
Do you think that we shouldn't have required childhood immunizations to enter public schools?
Dr. Ladapo.
I think that the Florida statutes are appropriate, and the Florida statutes provide mandated vaccines along with an opportunity for families, parents who believe otherwise to opt out, and I think that's appropriate.
So to get confirmed, he said the mandates were appropriate, and now he's going to try and put children at risk of contracting polio, measles, mumps, whooping cough, all diseases that have been virtually eliminated because of vaccines. We'll talk to Senator Polsky in a moment, but I wanted to get some sound medical advice, so I spoke to Ladapo's predecessor, DeSantis' first Surgeon General, Dr. Scott Rivkees.
Yeah, my first question is, why are they doing this? What's the deliberation behind this decision? First, we're not exactly sure what's coming out. We haven't seen an executive order. This is at variance with Florida Administrative Code. We know that vaccines are safe and effective, and all this means is that we're going to see fewer kids vaccinated, more kids getting measles, kids getting other conditions. And do we want to walk back to the era where we saw measles, pertussis, polio, meningitis? And what this really does, this also puts the public in a very difficult position. What is the public supposed to do? So this is very, very confusing and really potentially very, very dangerous decision from a public health lens.
How critical are these vaccines for school-age children? Just in terms of their development, their health, not just that, but also the health of other students around them and the staffs that they interact with at the school.
Yeah, I mean that's a really critical point about this, is that let's go back and look at what happened in Broward County when Broward County had the outbreak of measles. Then Dr. Ladapo pivoted from conventional recommendations for measles. If somebody has measles, they're supposed to isolate for 21 days. Well, he left it up to the parents to decide whether the children will go back to school. So instead of 20 non-vaccinated children isolating, 20% of the children in the school, 200 kids, did not go to school because their parents were afraid. What this means is that first, the vast majority of Americans are in favor of vaccinations. It's important to have a certain percentage of the population vaccinated because it doesn't always work. What this means is that people are going to be afraid to go out into public places. This means that we're going to have vulnerable individuals who are going to be more at risk for getting vaccine preventable illnesses. So the consequences of this, are beyond healthcare. It also affects education. It affects economics. It affects people's general view of well-being.
Do you believe that as a result of what Governor DeSantis and your predecessor, Dr. Ladapo, are now doing, that children may indeed die as a result of these decisions that they're making at the state level?
Look what happened with this recent outbreak of measles that this country endured over the past several months. We don't know the actual number of people with measles. It was likely in the thousand, but we had deaths. The last time we had deaths in this country from measles was more than 2 decades ago, of vaccine preventable diseases. We're seeing resurgence in cases of pertussis. In terms of the vaccines that can potentially not be given to children now, vaccines against certain forms of meningitis. When I was an intern and a resident, I took care of children with meningitis all the time. Now, many trainees don't face that because it's vaccine preventable. So it goes beyond just deaths, but it has to do with the illness that these different kinds of vaccines can prevent: measles, mumps, rubella, polio, hepatitis, meningitis. So it's pretty broad. And when we start hearing this messaging, it makes parents confused. We've told parents to follow the CDC recommendations, follow follow the medical organization's recommendations, and now they can become so disparate now that puts parents in a very, very difficult situation about how they should protect their children and themselves.
This all comes amid the backdrop of what's happening at the CDC. We've seen resignations, firings. We've seen a complete revamping there in what many consider to be a dangerous fashion by the Secretary of Health. Where are we now? I mean, as a country, when it comes to the issue of science?
Yeah, we're in a very dangerous situation. We've always relied on experts in our country, experts in society, whether it's healthcare, public health, meteorology, education, so many aspects of science that have built this country. And when all of a sudden we say we can't trust the individuals that we've invested so much of our country's future in, it becomes difficult. Where do people get information from now? So people get information from the internet. This can be unfiltered. You can have influencers who have a clear political agenda. So, we really have to realize where we were as a country, what we had valued in the past before, and where we can get accurate information.
To be clear, DeSantis and Ladapo cannot unilaterally do away with all vaccine mandates. As you can see from this list, vaccines for polio, measles, and mumps are all required by state law. It would take the legislature to pass a new law to change it. Vaccines for chickenpox and hepatitis B, however, are health department rules, meaning Ladapo can get rid of those on his own. So what will the legislature do? I spoke to Democratic State Senator Tina Polsky, and I asked her for her reaction.
The fact that this man is even our top public health official for so many reasons, not just this, but this is almost like his final, taking his bow, right? This is his last year of being Surgeon General. And this is the climax. This is the ultimate of what they were trying to get to. Every conspiracy theory, every quack idea he's had is to get rid of all vaccines. And he actually said, why would you listen to a doctor about what you put in your body? And so then what's the point of doctors? And why take an antibiotic? How is anyone ever going to get saved if they don't listen to a doctor? It doesn't make any sense. And this man is supposed to be our top doctor in the state.
What exactly is the role of the legislature going forward when it comes to this? What can the governor and Dr. Ladapo do unilaterally? And what do they need approval for from the state legislature?
So we have in place a statute that requires immunizations for all public school students, K through 12. And those are kind of the major vaccinations that we always talk about. That would require an act of the legislature to change the law to repeal that statute. So we have an important role to play in that. And for everyone who's listening, if this is something you are not happy with because you care about the safety of not only your children, but other children who are unable to get a vaccine for medical reasons and who are immunocompromised, and you don't want your child to be a carrier of a disease that will potentially kill another human being, you should right now speak to your legislators, your state representative, your state senator, and tell them you're opposed to this. Let's stop this thing before it even gets started.
What is this attack on science that we are seeing promulgated by the right?
I can't explain it because I don't understand it, but it only happened with the Trump administration, I guess the first administration, even though he takes credit for Operation Warp Speed and getting us the COVID vaccine that saved millions and millions of lives. All credit to him for getting that thing done really fast. But that's because the mRNA technology had been studied and worked on, and money given to it at universities and grants and NIH and all of these organizations working together for the health and safety of all of us. It would not have been available if science hadn't been working on this kind of technology. And something happened during COVID. I don't know if it was people's isolation or their fears, or maybe some people did have a bad reaction, but people went nuts. And you remember the ivermectin and this and that, and coming up with all their ideas. I think social media is hugely to blame. These parents would not be saying that their children shouldn't have vaccines if they weren't digging down some rabbit hole on the internet.
Well,
And so
let me say it this way, though. I think that I think I agree with you that COVID is the watershed moment for the anti-science movement, and I think that there were some serious mistakes made during COVID. I think things were locked down too long. In hindsight, I understand it, because when you're dealing with a pandemic and you don't have a playbook for it, you try things, and in hindsight, I think schools were kept closed too long. I think masking children probably wasn't a good idea. I think there are a lot of mistakes that were made that are now being used as the excuse to deny all science. I think that's the larger question. Do you agree, though, that some mistakes were made during COVID? And is this the natural result of it?
I don't think it's right for me to say that mistakes were made, because I am not a scientist. I am not a doctor, nor are 99% of the parents in the state of Florida who are now going to be tasked with if this goes through, tasked with the idea of, should I vaccinate my child or not? Should I believe my pediatrician or not? I am not going to sit here and question if we did the right thing during COVID. But what I will tell you is that the intention was always good. The intention was to keep people safe and alive and healthy. And so I don't have that anger towards people for wanting to overprotect, because I know that it was done for the right reasons. And hindsight is 2020. It's very easy to go back and say, yeah, kids wouldn't have transmitted it without the masks if they were in school. But how would we know? Like you said, this has never happened before, and we were just trying to be safe. So,
well, I want to jump in. There's also a practical result of all of this, where the denial of immunizations and the rest of it is that because these things are not going to be required by either the CDC or the Florida Department of Health, it gives insurance companies the ability to not cover these immunizations the way they normally would. As a result, are you concerned that there is going to be an inherent cost for those who do want to move ahead? Dr. Ladapo and the governor talked about parents are free to get their child immunized, but it's not going to be as free as it was because of the costs associated with these decisions they're making.
100%. We are so concerned with the affordability of this issue and what it's going to do to all Floridians. So imagine there's going to be a haves and a have-nots. There's going to be people who have good insurance, who like to go to their doctor and talk to their doctor, and who are going to immunize themselves. I mean, I'm looking forward to getting my flu and hopefully COVID booster this year. And if I have to pay for it, I have to pay for it. If my insurance covers it, great. If it doesn't, I will still pay for it. But I'm able to do that. There are many people who won't do that for so many reasons. They don't have a doctor. They don't have insurance. The Trump's big, beautiful, ugly bill is going to take away Medicaid, excuse me, from so many people. And Obamacare premium is going to go through the roof. And so there are going to be many people who do not have health insurance. So even if their health insurance will cover it, they don't have it. If their health insurance doesn't cover it because now they're not required to, then they have to pay out of pocket. And so it's going to take certain people to go out of their way to find a doctor who's going to give them the vaccine, if the vaccine is even available. And then there's going to be so many people who absolutely cannot afford to get the vaccine or to have the time or the knowledge to do it. And they are the ones who are going to suffer. And so all of Florida public health is going to be affected because in the end, we pay for those emergency room visits, we pay for the hospitalizations, and it's going to hurt the most vulnerable among us because they won't have the ability to get vaccinated.